Neurological case taking. We will discuss complaint and history of present illness. The chief complaint should be taken patient own words with no medical terminology. Onset, course, and duration would be mentioned. We will use descriptive terms like VCA, heaviness or weakness but not paresis, tingling, burning but not hyperesthesia, decreased sensation or numbness but not hypothesia, shaking but not tremors. Present history, we analyze the symptoms, onset, course, and the duration, associated symptoms, what are the aggravating factors, related investigations and medications, other symptoms of the related systems, either present or not, symptoms suggesting other system effects. The onset may be sudden, taking seconds to minutes like in cerebrovascular stroke, acute, taking hours to days as inflammatory conditions, gradual, weeks to months like tumors, insidious, and degenerative disorders. The course may be stationary in heredofamilial disorders, intermittent, with patient complete free in between the attacks like in migraine and epilepsy, remittent with relapses and exacerbations like multiple sclerosis. It could be regressive with improvement of the condition like in cerebrovascular stroke and inflammation, or progressive with worsening of the condition over time like in tumors and degenerative disorders. We should analyze systems of the nervous system. First, we will discuss symptoms of increased intracranial tension like headache, which usually is aching, early morning headache increased by coughing or leaning forward, not relieved by analgesics. It is frontal in supratentorial lesion and occipital in the infratentorial ones. Usually associated with vomiting, which is projectile, not preceded by nausea, not related to meals, more in the early morning, and blurring of vision. Symptoms of cranial nerve affection, olfactory, anosmia or parosmia, optic nerve, visual acuity and the field of vision, oculomotor, third, fourth, and sixth cranial nerve, ask about diplopia, trigeminal, sensation in the face and muscles of mastication, facial, taste sensation and motor supply, vestibulocochlear, hearing and tinnitus, and also we ask about balance like vertigo or dizziness, glossopharyngeal and vagus, bulbar symptoms, dysphagia, dysphonia, dysarthria, and nasal regurgitation, spinal accessory supplying trapezius and sternomastoid muscles, hypoglossal, moving food bolus in the mouth, and dysarthria if there is hypoglossal. Symptoms of motor affection could be positive like convulsions, tremors, abnormal movement, negative like heaviness, weakness. We analyze onset, course, duration, symmetrical or not, uni or bilateral, taking upper, lower limb or both, proximal, distal or both, presence of diurnal variation like in neuromuscular junction disorder, associated wasting or sensory manifestation. We ask also about incoordination like intention tremors on reaching the target or dysmetria. As regards sensory affection, we may encounter positive symptoms like pain, tingling, pins and needles, or negative numbness and hypothesia. Analyze onset, course, duration, if it is uni or bilateral, upper limb, lower limb, or both, symmetrical or not, and if there is any deep sensory. Sphincter affection, bowel and the bladder control, and the presence of erectile dysfunction. We ask about symptoms suggestive of loss of consciousness or fits, its onset, course, duration, what is precipitating factor, if there are seizures, are they focal or generalized. We will discuss areas of cerebral cortex with special centers in them. The frontal cortex contains motor area 4, pyramidal cells which control the voluntary activity of the opposite half of the body. Premotor area 6, extrapyramidal tracts that control muscle tone of the contralateral half of the body. Voluntary conjugate eye movement 8, for saccadic movement shift from one reading line to the. Broca's area 44 is the speech center for in the dominant hemisphere, and axonar area 45 is the writing center in the dominant hemisphere. Prefrontal cortex responsible for personality and behavior and memory. It is inhibitory for the primitive reflexes. The paracentral lobule, controlling bowel and bladder for cortical inhibition. Parietal cortex contain cortical sensory areas 1, 2, and 3 for sensation of the contralateral half of the body. Supramarginal gyrus area 37 that store and record complex voluntary motor movements and speech. Angular gyrus area 39 for reading in the dominant hemisphere. The temporal cortex contains auditory sensory area 41 and 42 for perception of auditory stimuli, and the auditory association area 22 for recognition and recall of sounds. It also contains limbic system, which control many aspects of the memory, mood, and smell. Thank you.